The Papua New Guinea Medical Board is responsible for all health professionals working in the country's health system. It is also responsible for the registration and licensing of private health facilities, as well as developing standards and upgrading procedures for health professionals. Recently, questions were raised in Parliament regarding the board's performance, particularly that of its chairman. In a series of questions to Health Minister, Maprik MP John Simon questioned the association between the PNG Medical Board and a leading private health provider in the country, given that the current chairman of the medical board was also consulting at this private hospital. Mr. Simon also questioned the manner in which the current chairman was appointed.
Can the minister confirm that the chairman of the medical board of Papua New Guinea does more consulting jobs at PRH as a consultant than Port Moresby General Hospital? Can the minister also confirm that the Medical Registration Act requires that the registrar of the medical board to maintain a register to the registered practitioners and also have the registered gazetted and published annual results, which helps the citizens to know which doctors they go to seek medical attention, especially the private doctors? Mr. Speaker, if these questions are true, can the board be investigated by the minister to set up an inquiry and get the board investigated?
In responding, Health Minister Puka Temu stood by the medical board, saying given the important role of the medical board in regulating all medical practitioners, the board continued to be strict, especially under the current board chairman.
Anybody who does not comply with the registration law that the board is administering, they should never be registered. And of late, you may have heard that a certain organization which hires doctors from Australia, for example, has been given notice because they have not been complying. And so I can assure the Honourable House that on the main, the board is doing a very, very good work. The current Papua New Guinea Medical Board chairman is a very, very, very good chairman. And right now, for example, he's not allowing YWAM ship to leave because of the issues of registering the volunteers in YWAM. And that's how strict he is. And I've been talking to him. Other political leaders asking me to fast track it, but the chairman said, no, they're not complying with the law. They must comply with the law. So that's an example of how strict the board chairman is.
Minister Puka, however, mooted impending changes to the country's medical registration bill to make it more conducive to the changing medical environment in the country. The amendment aims to include the regulation of medical practitioners engaged by private companies as well as NGOs, which is not the case at present.
So we make sure that the new medical registration bill that we have worked on is now being finally vetted by myself. It's on my desk at the moment to make sure it aligns very well with the 21st century medical practices going on, both public and private.